Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Good afternoon, everybody. Thank you for joining us for this live webinar where we will discuss how to diversify your business while improving client outcomes through transitional care programs. My name is Samantha Mills, and I'm a product marketing manager here at Axxess. Before we get started, let me tell you a little bit about Axxess. We are a leading home healthcare technology company offering a complete suite of easy-to-use, innovative software solutions, empowering home health, home care, and hospice providers to grow their business while making lives better. Today, you'll hear from industry expert Tammy Ross, Senior Vice President of Professional Services here at Axxess. She leads a team of professionals whose goal is to provide practical, operational solutions for care in the home organizations. Tammy has over 30 years of home health experience and has been a senior executive of a large national home health organization. Before we get started, just a couple of housekeeping items. Everyone's phones are muted. However, you may submit questions throughout the webinar. If time permits, Tammy will answer as many questions as possible at the end. If we don't have time to answer your question, we'll follow up with you after the webinar. And also following this webinar, we will provide everyone with a link to the slides and post a video recording of the webinar on our website, axxess.com. So I will hand it over to Tammy.
All right, thanks a lot, Samantha, and thanks to all of you for joining us today. Before we get started, I just want to talk a little bit about kind of why we thought that this would be a great opportunity to discuss transitional care. COVID-19 lockdowns have been happening throughout the United States in nursing homes. And I wanted to share this article from AARP posted on September 3rd, 2020. So just to give you a brief summary, when COVID hit in the US, sending long-term care into lockdown, this is a picture of Helen on the left-hand side. She was confined to the second floor of her complex for many months, almost 5 months. She had some early stages of dementia already, but when COVID hit, she wasn't able to get out and do her walks anymore. She wasn't able to interact, so she started to decline rather rapidly. At the end of 5 months, her daughter, Evan, decided to take her out of the long-term care facility and bring her home to hospice. You can see her picture on the right. That's a 5-month period. She's became a COVID casualty. 70,000 long-term care residents have already died from COVID. They account for 4 in 10 of the pandemic deaths. I'm proud to be a part of Axxess, where we know that the future of healthcare is in the home, and we like to do everything possible to make sure that we make it easy to deliver those operational and practical solutions to make it possible for our clients to have patients and clients that age in place in the home. So our objectives for today is we'll take a look at the change in workforce demographics. We'll talk a little bit about the Silver Tsunami and how that supports private duty care. It's a huge opportunity for those of you that are in private duty, or those of you that are thinking about adding that as a service line. We're going to take a deep dive into multiple patient care stakeholders. We'll look at their goals for transitional care and disease management and understand the benefits of private duty along the continuum. And then we'll take a look and explore successful transitional care building blocks to include staffing, training, and marketing. That's a lot for an hour, so we're going to go rather fast. I encourage you to type in those questions. If we don't get to them now, I will answer those by email. So take a look at healthcare by the numbers. What's going on? $4 trillion in spend rate by 2020 and $5 trillion in spend rate by 2025. That's a huge spend for Medicare. It's second only to our national defense budget. And 1/3 of Medicare spend is on about 10% of the populations. Those are those chronic care patients And those are the patients with our Medicare and Medicaid. They often have multiple needs, so much so that they account for 10% of them account for 1/3 of the Medicare spend. That's equating to about 3.6 million a year patients or potential patients that are older, sicker, and have multiple costly chronic conditions. If we look at what life expectancy was back when Medicare actually came to be, which was in 1965, about 55 years ago, life expectancy was only 70 years old. Life expectancy now is 79 years old. So when you look at those numbers alone, you can see why our government, CMS, are looking for alternative ways to actually work along the continuum of care for chronic disease management, which includes transitional care. This is just a visual of that silver tsunami. I think sometimes it's good to see it this way. You can just see that wave going up to the top and looking at those that are older than 65 climbing to the top of that peak. And this estimate ranges from 2010 to 2060. So you can see there's going to be no dip in the future years. So 10,000 Americans become eligible for Medicare every day. That's 3.6 million who are older and sicker, requiring more care. Again, that $4 trillion spend rate. And our average nurse is about 50 now in the post-acute setting. So what's happening as the regular population ages, so does nurses. Why is that important to private duty? Because I truly believe that there's a change along that continuum and a real place for home care providers, CNAs, specially trained navigators that can help this population. There's been a lot of changes in Medicare reimbursement lately. In fact, Medicare Advantage plans are now seeing the true value in private duty care and are starting to pay for those services that used to not be paid for. Those are the services that sometimes were considered custodial. They're the services for activities of daily living, sitter services, respite services. Medicare Advantage plans have seen the value in private duty and are now actually paying for that. So when we look at healthcare occupations and the projections in 2028, you can see that there's a huge increase for personal care service workers, home health aides, nursing assistants, registered nurses, and personal care aides. But truly, when you look at that group, when you look at that personal care aide along with the home health aide, that's the largest growth opportunity. These are those aging patients that need assistance with activities of daily living. So what is transitional care and what is that opportunity for private duty services? Why is there a huge opportunity? Because about 40% of the patients that are discharged from the hospital with home health instructions don't receive health care. They go home without home health care, without hospice. Many of them don't qualify for it. Many of them do not have plans that support it. So they're going home and there's this huge gap. In that gap is where private duty can live. The one thing we know about baby boomers and those that are called the veterans generation, that group right above baby boomers, is they were savers. They have money, they have disposable income, and they're willing to invest that in their health care. And they're especially willing to invest if there is a value add and they can see that value add. That probably represents about $2.5 billion in revenue. We're estimating that could be a little low, but additionally, $2.5 billion in revenue lays in that gap. 70% of those adults over 65 will prefer home health care, care in their home, over institutional care. And as I said, they have the income to actually invest in it. The home care market alone is expected to grow to about $187 billion by the year 2026. And it's those private duty agencies that are thinking out of the box and are starting to look at transitional care. They're starting to look at their data. They're starting to look at ways to really become that value partner along the continuum that have the most opportunity for growth. So let's just get a baseline of what transitional care is and why do we want transitional care. It's to establish a seamless system to manage a patient or client through diagnosis, treatment, and discharge, with the goal of allowing patients to age in place in their home. When we look at the goal of transitional care, and there's a lot of stakeholders for transitional care, a lot of payer sources, hospital systems, accountable care organizations, Medicare Advantage plan, which is a payer source. But when we look at that, we can see that private duty certainly has a place at the table. Those targeted populations are seniors with multiple chronic conditions, seniors that are returning to the hospital frequently, and really any age group being discharged from a facility that's had a procedure, that's had a long hospital stay, and that needs some assistance once they get into the home environment. And I put that caveat in there because even young people that maybe have a low health literacy, or maybe they have multiple comorbids, multiple diagnoses that are making their case very complicated. Maybe they don't have a good support system. They're a candidate for transitional care as well. And where do we see transitions? Well, we mentioned the very first one, and the one that most people think of the most is hospitals. We certainly know that hospitals, especially for patients on Medicare, they have limited bed days. They are actually on a system that is called DRGs. They're actually looking at patients and saying, with this diagnosis, you're allowed this many days in a hospital. That's very much oversimplified, but that kind of gets to the meat of it and to the fine point of it. They're limited based on diagnoses. So to be able to transition them and be able to transition them safely is a huge goal of a hospital. Nursing homes, we'll talk a little bit about a new program called Money Follows the Patient. It's to help patients transition out of nursing homes and back into the home environment, especially in the wake of the pandemic. There's a lot of money being put forth towards this transition. So nursing homes have become stakeholders. Nursing homes are also full, they're at capacity. They want to have a place at getting those patients transitioned so they can support patients that may better fit a long-term care environment. So they're really truly partners in care. Assisted living facilities, although assisted living facilities want to keep their beds full, that's a goal for them. Right now, there's a lot of staffing challenges going on in many states with assisted living facilities. They're limited on patients that they can bring in and patients that they can maintain. And I'm actually going to tell a personal story in a moment about assisted living facilities. Rehab centers, those are rehab facilities that are freestanding and also skilled nursing facilities where patients go for rehab for X amount of days, usually about 21 days. They are definitely looking for partners that can transition that patient back into the home and make sure that they're safe and don't have to return to an institutionalized setting. Home care and hospice, they can't keep patients on service forever. They are actually regulated by CMS. CMS have certain rules that have to be maintained. And if patients don't meet these rules and these guidelines for whatever reason with home health, maybe they're no longer homebound. Maybe there's no longer a skilled need. You're looking for partners to transition that patient safely into the community. Hospice, patients don't always die on hospice. You can have patients that actually improve because they're getting that one-on-one care that hospice can provide. And they're looking for care partners to transition that patient. Oftentimes, they'll transition them to home care. But in addition to that, hospice generally can provide more supported services like the bath aid, the home health aid. Home care is kind of limited in that with the new reimbursement schedules and may not be providing as much personal care services. So hospice are looking for people to partner with. Those are just some transitions. There's a lot more. There's outpatient surgery centers. There's many others that we could talk about, but we'll limit it to these for this presentation. We always want to look at why are people interested in transitions? Why is that a big buzzword now? It's to control disease and it's to manage disease. And when I say disease, that's conditions, that's functional limitations. And there's going to be people that have different reasons for wanting to be a stakeholder and different reasons for controlling that patient's disease or condition. And we'll talk a little bit about that. The patients, families, and communities have reasons, providers have reasons, and then payer sources have reasons. So let's take a look briefly at what disease management is and see if you can kind of picture private duty along this continuum. First of all is structured treatment plans that aim to help people get better or manage their chronic disease better. They want to maintain and improve quality of life. While I know private duty agencies certainly have structured treatment plans, they certainly help manage chronic diseases in multiple ways. And certainly private duty caregiving services maintain and improve quality of life. They reduce symptoms associated with a chronic disease and keep patients from getting worse. There are many things that private duty agencies can do to help manage disease, to include medication reminders, safety evaluations, just decrease in depression because these patients have contact with somebody. That's going to improve disease management and manage chronic care probably more than anything else we could do, any singular thing we can do. Private duty can prevent complications or accompany diseases from even developing because they can watch for signs and symptoms, things that the patient or the client themselves may ignore. And certainly it improves the quality of life as it allows patients to age in place in their home. We can certainly see disease management fitting in with, we can see private duty fitting in along this continuum for disease management. So what I recommend for private duty is a care navigator, care coordinator. You could give it many terms, but it doesn't have to be a nurse. It doesn't have to be a clinical person, but it's someone that really engages the client and the family to ensure that all aspects of the care plan are followed. When you're discharged from a hospital, there's multiple instructions. There's multiple things that you have to get ready for in your home. It could include equipment. It can include medications, meal management, transfers back to your upcoming appointments, maybe specialty appointments. Care navigators can kind of coordinate all of that for clients. It aligns directly with hospital acute and post-acute care services. So care navigators' duties kind of marries all of those together. They're kind of the liaison between all of that and coordinates all of that. It meets the patient. A care navigator's kind of job role will meet the patient and prepare them for discharge. And then they'll also evaluate those patient goals for treatment. What is the patient's goals? Because hospitals, home health, hospices, we all have goals for the patient, but if that's not the patient's goal, then the patient is not going to meet those goals, right? So care navigators really get to the heart of what the patient desires. They're just an integral part of a private duty transitional care program. And they may not necessarily be the person that sits with the patient full time. They may not be the one that provides the care themselves. In fact, most private duty agencies I work with, care navigators, have several patients and several private attendants that work under them. And they do more of the coordination of care, and the private attendants do more of the hands-on care. So I want to give you a case example, and this is actually of my dad, Dallas Dixon. This is an ALF facility. They're absolutely beautiful, and they're absolutely, a great alternative for people that maybe don't want to age in place in the home. Maybe they don't have family to support them. There's multiple activities, but for some patients, and a lot of patients that have dementia like Helen that we mentioned earlier, it's just not a good place if families can't get in and see them. My dad was absolutely one of those cases. When COVID lockdown occurred here in San Antonio, Texas, he was in a memory care unit. He was used to at least daily visits, sometimes 3 times a day visits from my mom, myself, and my daughters. So he had constant interaction with his family, even though he was in an assisted living facility. Not having that personal contact with him and not being able, he wasn't able to really hear well on FaceTime. That wasn't a good option in his advanced disease. Caused his dementia to exacerbate tremendously, to the point that the staff could no longer take care of him in the facility. They actually called me and asked that I pick him up within 4 hours, and this is in the middle of COVID lockdown. So you can imagine trying to get your home ready in 4 hours when you have no access to equipment, gloves at that time. Couldn't find hand sanitizers, certainly couldn't find things that we needed to take care of him. And also trying to source caregivers that would be needed to kind of meet his basic needs 24/7. So I actually worked with a company that I had consulted with many years earlier, and I said, we really need to develop this into a service line. It really needs to be a transitional care program. And this particular company, within a week, was able to source caregivers. They were not able, obviously, to source equipment. That wasn't part of what they did, or make the home modifications that I needed to make it safe in the home. Luckily, I'm a nurse. I'm also a case manager. So I eventually was able to source that equipment. But it made me think about, wow, what a great service that would be if private duty could do it, could have done all of that for me. If they could have came out and built the ramps for me, if they could have came out and made the home safe for me, if they could have provided the equipment, the gloves, the supplies that I needed, wouldn't that have been a great package deal? And going forward, this particular organization is doing that. I'll actually show you some of their flyers at the end of this presentation. They have tripled their monthly hours in a very, very short time, just a couple of months since launching their transitional care program. So I can tell you that it's a real need, and I can tell you that from personal experience, it's a huge need. And I would have not been able to take care of my dad if it hadn't been for the private duty agency that sourced caregivers. And now knowing that they're available to assist other families to transition, and even, have things in place like some camera, some Tele-Touch and Telehealth equipment in place to make it even easier. It's just very exciting to see. So when we start looking at transitional care, we actually look at, what's the gears of that program? What do you need to really focus on in your program? First of all, you've got to think about policy. What's the regulatory or the state guidelines? Many of you guys have state guidelines that you have to follow. You have practice acts. What can CNAs do? What can you do up to the top of the CNA's ability based on your state? What are some of the regulations for the pandemic? What are some of the waivers that are being allowed for the pandemic? What's your vision of this program? What kind of service lines do you see? Where do you want to go? Maybe you don't want to get into building ramps and doing safety equipment, but you really, really want to get into a package deal for maybe you assist with meals, you assist with transportation, you assist with discharge planning. You really have to think about what that vision is and what you can do to staff that vision. You really have to look at clinical and patient administration system, PAS. Do you want to train your caregivers at a higher level and actually make them, where they can do more? And how are you going to do that training, which kind of gets into staffing? Also looking at the geographic region you want to cover. Do you want to work with hospitals? Do you want to work with rehab clinics? Do you want to work with multiple systems or just one? That's all things that is part of your strategic plan. What about staffing? Training, oversight. The one thing we know about staffing is you can't scale if you can't staff. That's probably the biggest challenge in private duty today, is being able to staff and be able to staff with trained caregivers. What's your budget? Maybe you're not able to spend a whole lot to get this program off the ground. Maybe you have some capital expenditure you're willing to invest. Maybe you're wanting to do a huge marketing campaign, which would include social media campaigns and some really creative graphics and so forth. Those are all things that you have to think about when you're ready to start transitional care. And then looking at technology. I work for Axxess. I'm proud to work for Axxess because I know Axxess offers the technology that's needed to be able to transition patients safely home. We have electronic visit verification, so we know for sure that client is receiving care from that caregiver at the time we think they're supposed to be there. We're also able to be notified if that caregiver is late. Those are some of the enhancements in technology. We were one of the first technology vendors that was able to put COVID safeguards in place, not just for patients, but for staff. Those are all things that you have to think about when you're looking to start a program. Is there a plan of care built in? Is that plan of care customizable to the patient? And does it meet all the compliance boxes that you need to check off for your state and for your regulations, whether you're JCO or CHAPS accredited? Are there telehealth programs built in so that you can actually see that patient, and are there pathways built in for telehealth? These are all things that you have to consider when you're thinking about technology and how it can enhance your transitional care program. So those gears could each be talked about for at least an hour in and of themselves, but I want to just hit some highlights because we only have 30 minutes left, and the big ticket items for you, like pandemic regulatory changes. Telehealth reimbursement is state specific, but here in Texas, Medicaid does reimburse for telehealth. So looking at pandemic regulatory changes, we know in home health and hospice, telehealth is being allowed in hospice to count as a visit. Not necessarily in home health, it's being allowed, but it doesn't count as a visit. The one I mentioned before was MFP, money follows the person. This is a huge initiative because of the pandemic to get patients transitioned out of the nursing home and safely home. There's billions of dollars, $165 million to help transition these patients. Being involved in your state Medicaid program, you may be eligible for these Medicaid waiver programs to help patients get out of the nursing home and home. Maybe that's going to be your focus in and of itself, is this money follows the person program. Maybe that's where your care transition is going to be focused at. Maybe you want to work singularly with a Medicare Advantage plan. Multiple Medicare Advantage plans are reimbursing now for private attendant services, PAS. services, that's those caregiving services. Unfortunately, they're not really wanting to pay as much as they should for those services. So when we start going to contract with Medicare Advantage plans, it's going to be really important that you have the data to show them as to why partnering with you is going to keep their patients out of the hospital. That's one reason I recommend Axxess. We have business intelligence and business analytics that'll help home care agencies pull up statistics to show reduction in hospital rate, improvement of things such as TUG scores. That's the time up and go score, which is a score that's very easily done by private attendants, by CNAs, that helps to judge a patient's fall risk. We know when we put sitter services or PAS in the home that they can work on balance, they can help with home exercise programs, and they can improve those TUG scores significantly. But you have to have a way to quantify that data. Using Axxess Business Intelligence tools is a way to do that. So being able to pull that out, that's part of your strategic plan when you look at transitional care. Do you want to make sure that your technology company can support you in this and the value of having this business analytics? Some of you on the line, we can tell our Axxess clients already, you have this available to you, the business intelligence, and you can just reach out and talk to someone at Axxess about how you can sign up for the business intelligence that would support these data analytics. So another part of your vision is looking at service lines. I'm going to give you a few things. There's multiple more when you want to look at transitional care. First of all, it's the PAS services in the facility, and I call it Sitter Care Plus. You take a dementia patient and you put them in an institutional setting where they're being woken up every 4 hours for vital signs, maybe every 2 hours. Someone's coming in and bringing meals or bringing snacks, checking on them. Then you've got medications that's really going to exacerbate dementia. Often these clients need one-on-one care. They're placed on a one-on-one, which means that either the family has to sit there with them because they're a fall risk or they're a risk, to harm to themselves or others, or somebody else has to sit there with them, like somebody from a private duty agency, from a home care agency. If you have that individual that can sit there with them, but also is trained so that they can help transition them home, they can receive those discharge plans for that patient. We're in a very global world now. Oftentimes, family don't live in the same state, so they're not able to take off work and come and provide that service themselves. If there was someone that they could rely on to do that, there's many, many people that would pay for that service. Even in the pandemic, if patients are placed on a one-on-one, they're allowed to have a sitter come in. And I know, that those rules are going to vary state to state, but that's currently in Texas, and I know that from experience. My dad is in the hospital now, so I know what that one-on-one feels like. If I wasn't here, if we didn't have family here, we would be looking for a sitter care to be able to provide that for him. We mentioned the discharge instruction. Along with discharge instruction, that these private attendants are these care navigators. Maybe you want to pull in your care navigator at that time. Maybe we're going to have home care involved. We're going to need meals delivered. We're going to need some modifications made to the home environment for safety reasons. We're going to need follow-up physician's appointment. Let that care navigator receive that instruction and actually coordinate with all those services. That's a huge service in and of itself. Rehab aides, if they're discharging from a rehab facility, very important that we get rehab aides involved. Our CNAs can be trained to do home exercise programs where they're doing balance exercises with the patients, where they're walking and ambulating the patients, where they're teaching them to use their walker correctly. I know a physical therapist has to lay that plan out first, but certainly a CNA that's had advanced training in rehab can follow up with that. Transportation services, oftentimes the patients can't drive. They're not safe to drive or don't want to drive. So being able to drive them to their appointments, their follow-up appointments, is huge. It's going to prevent rehospitalization. Those care navigators can also do something called tuck-in calls, which is every Friday calling to check on these clients to make sure they haven't exacerbated, to make sure that they have all of their needs met. They have food in the house, all their medications are there. They're not having any personality issues with their private attendant who's providing caregiving and personal care for them. They're tucking them in for the weekend. Why? Because on the weekend, that's when patients that are over 65 and clients over 65 are most likely to end back up in the hospital. You can tell them a million times over that they can call your toll-free number. There's someone available 24/7 that will answer the call. They don't want to bother the staff on the weekend. So tuck them in on Friday. Do a sunshine call on Monday. See how their weekend went. Have a series of questions that you can ask them. Those two things alone are Tele-Touch points. It could be part of your package program. It's going to help reduce the rate of depression, and it's going to help drive down those hospitalization rates. I mentioned telehealth, and I'll show you a few slides on telehealth. It doesn't have to be expensive. You can use video FaceTiming. You can also use very cheap devices. Amazon, it's actually Amazon Prime Day today, and they are having two-way cameras for, I believe, $31. They're very good cameras. They actually can connect to Alexa. It makes it a very good way to check in on patients. Obviously, you have to have the patient's consent for any kind of the camera monitoring, but it's a good option that doesn't require a huge outlay and a huge expense. Training of your PAS is going to be your private attendance services is going to be huge. How are you going to train them for that next level? You might be able to coordinate with home health and hospice, also with Alzheimer and dementia groups. They're willing to come in and do compassionate care training about Alzheimer's. There's multiple ways to source training and to do it very inexpensively. Also, multiple online trainings. Care coordination, I think, is the key. We have to be able to coordinate all their care across the continuum. That's the key that's going to make your transitional care program successful, and it's going to make it a value add to patients, to families, and to stakeholders. Home maintenance, I mentioned that. It is so hard to find a handyman, even if you're not in the position of needing private attendant services. But certainly for elderly people, folks that can change out batteries in the smoke detectors, can change out light bulbs, they can do simple home maintenance all the way up to, installing handheld showers and grab bars and that kind of thing. Attending physicians' visits, a huge service. So someone's hearing other than the patient what the physician's saying. They're taking notes. We have a wonderful family portal that we can upload these notes into so that the family members can see them and actually know what the physician's saying and what's going on with their patients. Pharmacy and medication management is another big add. Being able to manage those refills. A lot of people have their medications mailed to them every 3 months. If the medications changes, trying to get them back in that cycle for those mail-in prescriptions can take a while. So what are we doing in the meantime? That's a huge care coordination issues. Assistance with home management, like paying the bills, doing simple housekeeping, another part of transitional care, or could be part of your transitional care package. Meal preps. Everybody's doing meal preps now for dieting. They're also important for elderly and for people that maybe can't fix their own meals. Maybe they can put it in the microwave. Maybe you want to look at having your private attendants actually do those meal preps for the client. Housekeeping services, we mentioned. How about pet services? A lot of our elders have pets in the home. They're not adequately able to groom them, take them to vet appointments, especially after a stay in the hospital. Lawn maintenance, just general ground maintenance, making sure they don't fall or slip when they're outside if they're able to get outside. Socialization. Sometimes it's just nice to have someone to come in and, do crosswords puzzles, or to play cards, or to do something for a couple of hours to provide that socialization. COVID's caused a lot of isolation, sorry, let's get my two words confused there, isolation recently, and especially our seniors are suffering from that. So just socialization alone may be a part of your program. And then hospice and palliative care, to be a supplemental service when someone has hospice and palliative care, and to be able to be trained at that next level so that these attendants are very sensitive to death and dying, and they understand, the grief cycle, and they understand how to work with these patients that are on hospice and palliative care. Huge parts and things to think about along that transitional care vision. So I mentioned I would show you a few things as you start thinking about how to build your program. This is medication management that private duty can do. Medication tip sheets. You see here's a medication tip sheet. It's the very first piece of paper. It's actually a free download. If you just go Google medication tip sheet, you can put your logo on it. And it's just a really good set of instructions to give to patients. Things like, don't share medication, brown bag your medication if you go somewhere. That's put all your medications together and take them with you so your doctor or your ER can see it. Pill boxes. A really good marketing technique is to give your patients a pill box. I happen to like these because they're portable. You can actually pop out the days of the week. The one thing I would recommend with pill boxes, if the patient has problems with vision and maybe dementia, color the bottom of that pill box with a black Sharpie marker. It is very, very difficult to see white pills on a clear or white background if you have visual problems. That in a set alone will help patients be able to see their meds because it's up against the black, and keep those medications from getting into the corners and not being seen, especially those little water pills and little heart pills that they take that get stuck in the corner. Use of a pill box, again, you can download this graphic, you can put your logo on it, and you can deliver that along with that pill box as a gift for being in the transitional program. Medication tracking and monitoring. Some of our private duty services actually track when that patient takes their medication. You can do that on a form such as here, or you can do that electronically. All ways, though, to get your branding out and to kind of package your program. So home maintenance, we talked about the safety enhancements like bathroom equipment. Lighting is huge, especially in elderly homes. Even if it doesn't mean rewiring the house, but maybe getting some very cheap battery operated lights that we can install on stair rails, or we can, just with Velcro, you can pop those on and it can light up. Very simple ways to actually enhance the safety in the home. That could be a whole part of your transitional program, that you offer a home maintenance check and offer recommendations. Making sure the house is decluttered is a big part, obviously, of home maintenance and transitional care as well. So if we're thinking of our gears, one of our gears was staffing. So we know it's very difficult to staff in home care. It's hard to recruit people that really are in it for the right reasons. Oftentimes we hear that the pay is too low, and oftentimes they're correct, it is too low. If they can get a job working in retail or get a job maybe in fast food industry, making the same amount of money, a lot of people will find that more desirable and less stressful than working doing private attendant service. So we have to make the pay match the work, right? And having highly trained caregivers that are able to provide multiple services, not just sitting services, not only increases the rate that you would charge the client, it would increase the rate of what you pay the caregiver. That's the way to recruit and retain a different level of caregiver. Caregivers want to know that their work is meaningful. They want to be paid for it. They want to have career paths. And they want to know that skills they have in other jobs are transferable as well. And then we got to be able to retain them. This is a quote that came out a few years ago on Home Health Care News. And it said that they know they need more caregivers and may have to hire 1.5 caregivers just to stay in the same spot year over year. So basically what they're saying is that the turnover is so rapid in our industry and private duty that just to stay in the same place, we have to hire 1 plus 50% so that we just are able to stay level, not even to scale and grow. So staffing, if I had to build a transitional care program now, I would start with this building block. I'd make sure the work was stimulating. I'd make sure that the leadership was solid. And I would make sure that I rewarded and recognized these caregivers. And just from a survey that was conducted recently, you can see the biggest factor that makes recruiting caregivers difficult is lack of qualified candidates. 55% of private duty owners and operators said that there wasn't qualified candidates for private duty. Well, I think sometimes we might have to think out of the box and think about how can we take people that's worked in other industries that are declining and actually transition them into caregivers. We have to look at where we're sourcing our caregivers. You know, looking at nursing schools, that's an excellent place to source caregivers. LVN, LPN schools, and RN schools. Looking at the military, if you're fortunate enough, like I am in San Antonio, to be where we have a large military community, people are transitioning out of the military daily. So working with that family support services for those folks that are transitioning, they'll let you advertise free there because they want to help their departing military members find jobs in the community. So work with your local bases, your local armed forces to help partner with the military vets, working with churches and working with displaced workers. I want to show you a quick graph here, and I know we don't have a lot of time to spend on it, but there's a lot of occupations now that are declining. HR assistants and payroll assistants are declining as more electronic ways are being developed to handle those things that people used to handle in the past. You can see that there's going to be a negative 4% decline just over the next 10 years in this occupation. Also, hotel, motel, and resort desk clerks. I think that number would be up now in the wake of COVID as less people are traveling. I would say that number has probably changed a little bit since 2018. Tellers, postal services, customer service reps, retail salespeople, and office clerks, all declining significantly. The thing that all of these people have in common is they have good customer service skills. How does that translate into private duty? You know, really, private duty is a concierge service line. It's about making your clients happy and delivering exceptional care. These occupations know how to do that. Now we have to train them in the hands-on, but hopefully you have a training program or a way to get those skill sets for them. But honestly, think about this as a way to actually look at who is available to do this line of business. Who can you start marketing and start talking to them about their transferable skills? Build that firm foundation the minute your people start to work. Orientation forms the foundation of work. It has to be organized, and it has to be consistent. It needs to be based on policies, regulations, and best practices. And you definitely want to have competency checkoffs. That's going to be important to the consumer to know that you have validated every skill that that person will be performing. And a very detailed job description is also important. So keys to retaining these employees: promote engagement at all levels, making sure they have touch points. So many times in post-acute home health, hospice, and home care, we're not really touching base with our fellow workers, our peers, our supervisors. Bring them into the office, even if it's going to cost you an hour of, administration time to pay them that hour of administration time. Bring them in for staff meetings. Have that physical touch points. Offer collaborative opportunities like preceptor pairing them up with somebody for training skills, providing very clear directions, and exploring their skill sets and interests outside of work. Keeping in touch with people for not just what they bring to the work environment, but what they do outside. Maybe, their child played soccer. Ask them about that. Do touch points. You can do conference calls, once a week. You can have everybody share something on that conference call. Even in the pandemic, we can do that. It's a way of bringing people together and retaining people and making them feel part of the organization. I think rewards and recognition is huge. Never underestimate the value of a handwritten note. A story just real quickly about my husband. He was in the military about 33 years. He was a commander many years ago, and he had a young troop come in. He actually wrote the mother a note telling her how wonderful that her son was doing. It was his very first assignment, and how he thought that this young man, was going to really develop into be a wonderful NCO and go far. So we fast forward many years later, we got invited to this young man's retirement. He was actually selected for early promotion. He was actually selected to be on a special group that worked with the president, worked there in the White House when we were stationed in DC. And when he gave his closing remarks for his retirement, he pulled out a note. That note was over 20 years old. It was the note that my husband had sent the mom 20 years ago, and he read it at his retirement. And he talked about how that really shaped his career and how important that single piece of paper was to him. So I would encourage you, handwritten notes, not computer generated, not text. They really mean a lot. There's a lot of human resources programs that you can get into to retain your staff. We won't go into them here, but make sure that that employee knows how meaningful their work is and how they're making a difference in people's lives and outcomes. Your budget and marketing, you have to determine what you can afford on your budget. You see the scissors there with budget cuts, right? Determine the value add for each of those stakeholders. How are you going to build those relationships? What kind of marketing campaigns are you going to use? Are you going to get involved in social media? Do you need equipment? Those are all things you need to think about. The one thing I will tell you that video capable devices, if you look at our seniors, they can use them now. This is pre-COVID up at the top, post-COVID down at the bottom. Look at that increase in our senior populations being able to use video-capable devices. 11% pre-COVID, 38% post-COVID. They want to use telehealth and telemonitoring equipment, so think about that. Making sure that you do those tele-touches, whether it's by phone or whether it's by a piece of equipment, it should be like you're in the room with the actual client. And I just put you a couple of little devices here. I really like the one at the bottom, that's Pilio. It's actually dispenses medications as well, and it allows for the two-way monitoring. It's about $100, and it's offered at many retail stores. The one at the top is actually a baby monitoring with two-way communication. Very easy ways to incorporate some telehealth in your transitional care program. They're very budget friendly, and it's going to help you keep eyes on that patient and help that patient feel safe that they have a way to get in touch with you. So lastly, I told you I would mention the company that actually started a transitional care program and are quite successful with it. They were definitely on a smaller scale budget, and basically the only thing they did to advertise was some printed material that talked about their transitional care program. It talked about their in-home safety interventions. They chose that as one of their things they were going to work on. Their assistance with medication and DME, rehab care. They targeted just a rehab care center, a SNF unit, one rehab care center. They were going to really work with medication reminders. They got the pill boxes together, medical appointment reminders, and transportation. Those are the keys to their transitional care program. And they passed this out. They're available to the case managers, and kind of the rest is history. On the right here, you also see just a little flyer that they left with multiple doctors that served in that facility to talk about their transitional care program and how that reduces the Medicare spend rate. So in summary, the pandemic has called to attention the need for private duty organizations to become major players in the continuum of care as patients transition from multiple institutional settings to their home. Private duty care is focused on safety, on disease management, and it's going to reduce hospitalization and improve outcomes for patients. At the same time, it's going to create additional revenue streams for organizations and to add that specialty program for transitional care. So I encourage you, now's the time. It could not be a better time to start up transitional care. I know I went a little bit long. We only have about 4 minutes. So Samantha, I think I would have time for maybe 1 or 2 questions.
Okay, we did have a question come through asking if you could clarify when you mentioned that 40% of discharges with instructions for home health care did not receive services. Why is that? Did they put a comment, discharge planners set up home health prior to discharge, or did you possibly mean home care instead of home health?
So they loop home care all in one bucket. So we don't know if that's home health or home care, but we do know that these folks that are receiving discharge instructions and a plan for care after leaving the hospital didn't receive any services from hospice, home care, or home health. So from any of those 3, so that there was absolutely no support for them when they went home. The article and the resource did not actually divide that up, but what they're saying is in that gap there's a huge gap that private duty could fill with just providing clarity on discharge planning and being able to help those patients transition to home, even if it's just for a day or 2. And that's where we see that huge growth opportunity in the millions and possibly even billions for home care agencies.
Great, thank you.
You'll see here tross@axxess.com. If you have any other questions or comments, or if you think of anything after this webinar, please feel free to email me. I'll get back with you as soon as possible. We wish you a very successful transitional care program, and if we can help in any way, please reach out. Thank you and have a great day.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.